Hello and welcome back to the LCSW Network. My name is Thomas Fletcher. I am your host. In today's video, we're going to be talking about Mental Illness Awareness Week. So every year from October 4th to October 10th, the United States, we recognize Mental Illness Awareness Week. We also recognize National Depression Screening Day on October 8th. And World Mental Health Day is on October 10th, but today we're going to look at Mental Illness Awareness Week. So, many people in our country, many people around the world do not seek treatment in the early stages of mental health because they don't recognize the symptoms. So during Mental Illness Awareness Week, we can, as LCSWs, we can educate the public about at least 7 major mental health conditions. So that's what I plan to do in today's video. Let us start with anxiety. So occasional anxiety is an expected part of life. You might feel anxious when faced with a problem at work, before taking a test, or before making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, school, work, and relationships. Anxiety disorders are among the most common mental illness in America. Over 21% of adults, or 42.5 million, are affected by these debilitating illnesses each year. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and various phobia-related disorders. So let's look at signs and symptoms. So for generalized anxiety disorder, people with generalized anxiety disorder display excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in areas of their life such as social interactions, school, and work. Generalized anxiety disorder symptoms include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, mind going blank, being irritable, having muscle tension, difficulty controlling feelings of worry, having sleep problems such as difficulty falling asleep, staying asleep, restlessness, or unsatisfying sleep. So again, as LCSWs, we can provide psychotherapy for generalized anxiety disorder and the other anxiety disorders with such practices, including cognitive behavioral therapy. But let's continue with bringing awareness about some other mental illnesses. So let's look at, for the next one, let's look at depression. Depression or major depressive disorder or clinical depression is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Some forms of depression are slightly different, or they may develop under unique circumstances, such as persistent depressive disorder, otherwise known as dysthymia, postpartum depression, psychotic depression, seasonal affective disorder, and bipolar depression. So let's talk about the signs and symptoms. If you have been experiencing some of the following signs and symptoms most of the day, nearly every day for at least 2 weeks, you may be suffering from depression, such as persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear physical cause and that do not ease even with treatment. However, as LCSWs, we do know that depression is a very treatable condition that we can treat with, again, such practices including cognitive behavioral therapy. But we also know that sometimes clients will benefit from medication, so we always refer our clients to make sure that they get a medical exam, and that's when the MD or the physician assistant can even consider talking about putting the person on an antidepressant, as we know. So let's talk about the next mental illness that we want to bring awareness to during Mental Illness Awareness Week. The next one that we're going to look at is psychosis. What is psychosis? The word psychosis is used to describe conditions that affect the mind, where there has been some loss of contact with reality. When someone becomes ill in this way, it is called a psychotic episode. During a period of psychosis, a person's thoughts and perceptions are disturbed, and the individual may have difficulty understanding what is real and what is not. Psychosis can affect people from all walks of life. Psychosis often begins when a person is in his or her late teens to mid-20s. There are about 100,000 new cases of psychosis each year in the United States. So let's look at the signs and symptoms of psychosis. Typically, a person will show changes in his or her behavior before psychosis develops. Behavioral warning signs for psychosis include sudden drop in grades or job performance, new trouble thinking clearly or concentrating, suspiciousness, paranoid ideas, or uneasiness with others, withdrawing socially and spending a lot more time alone than usual, unusual, overly intense new ideas, strange feelings or no feelings at all, decline in self-care or personal hygiene, difficulty telling reality from fantasy, and confused speech or trouble communicating. Symptoms of psychosis include delusions, which are false beliefs, and hallucinations, which means seeing or hearing things that others do not hear or see. Other symptoms include incoherent or nonsense speech and behavior that is inappropriate for the situation. A person in a psychotic episode may also experience depression, anxiety, sleep problems, social withdrawal, lack of motivation, and difficulty functioning overall. We know as LCSWs, if our clients are experiencing these symptoms, we need to put in a referral to a doctor, a psychiatrist. The person may even need to be hospitalized. So let's look at the next mental illness for Mental Illness Awareness Week. So the next mental illness that we want to look at during Mental Illness Awareness Week is post-traumatic stress disorder. Some people develop post-traumatic stress disorder, or PTSD, after experiencing a shocking, scary, or dangerous event. It is natural to feel afraid during and after a traumatic situation. Fear is a part of the body's normal fight or flight response, which helps us avoid or respond to potential danger. People may experience a range of reactions after trauma, and most will recover from their symptoms over time. Those who continue to experience symptoms may be diagnosed with PTSD. So let's look at who develops PTSD. Anyone can develop PTSD at any age. This includes combat veterans, as well as people who have experienced or witnessed a physical or sexual assault, abuse, an accident, a disaster, a terror attack, or any other serious event. People who have PTSD may feel stressed or frightened, even when they are no longer in danger. Not everyone with PTSD has been through a dangerous event. In some cases, learning a relative or close friend experienced trauma can cause PTSD. According to the National Center for PTSD, a program of the United States Department of Veteran Affairs, about 7 or 8 out of 100 people will experience PTSD in their lifetime. Women are more likely than men to develop PTSD. Certain aspects of the traumatic event and other biological factors, such as genes, may make some people more likely to develop PTSD. So let's look at the symptoms of PTSD. Symptoms of PTSD usually begin within 3 months of the traumatic incident, but they sometimes emerge later. To meet the criteria for PTSD, symptoms must last longer than 1 month, and they must be severe enough to interfere with aspects of daily life, such as relationships or work. The symptoms also must be unrelated to medication, substance use, or other illness. The course of the illness varies. Although some people recover within 6 months, others have symptoms that last for a year or longer. People with PTSD often have co-occurring conditions such as depression, substance use, or 1 or more anxiety disorders. After a dangerous event, it is natural to have some symptoms or even to feel detached from the experience, as though you are observing things rather than experiencing them. A healthcare provider such as a psychiatrist, psychologist, or LCSW who has experience helping people with mental illnesses can determine whether symptoms meet the criteria for PTSD. And again, as LCSWs, we can become trained in providing such evidence-based practices such as prolonged exposure or cognitive processing therapy. So let's look at another set of mental illnesses during Mental Illness Awareness Week. So the next one that I want to highlight are the eating disorders. Let's talk about eating disorders. The way we talk about eating disorders matters. Here are some facts that you can use to help shape the conversation around eating disorders. So here's one. Eating disorders are medical illnesses. Genetic and environmental factors can influence eating disorders. An eating disorder is not a trend or a choice. Here's another one. Eating disorders are serious and can be fatal. Eating disorders can involve serious medical complications that can cause permanent damage or death. People with eating disorders also have an increased risk of dying by suicide. Here's another one. Eating disorders can affect anyone. Eating disorders do not discriminate. They affect people of all ages, races, ethnicities, and genders. Here's another one. You can't tell if someone has an eating disorder by looking at them. People with eating disorders can be underweight, normal weight, or overweight. Okay, here's another one. Family members can be a patient's best ally in treatment. Eating disorders are caused by a combination of genetic, biological, behavioral, psychological, and social factors. Family members do not cause eating disorders and can be a great source of support. Last one that I want you to think about for eating disorders is it is possible to recover from an eating disorder. Complete recovery is possible with treatment and time. Okay, let's look at let's look at our sixth category. So for the sixth mental health disorder that we're going to look at it during Mental Illness Awareness Week is bipolar disorder. Do you feel happy and outgoing, or very irritable on some days, but unusually sad or anxious on other days? Do the up periods go along with increased energy or activity? Do the downs go along with low energy, hopelessness, or inability to enjoy what you usually like to do, and sometimes suicidal thoughts? Do these mood swings make it hard to sleep, stay focused, or get things done? Some people with these symptoms have a lifelong but treatable mental disorder called bipolar disorder. So let's look at what is bipolar disorder. Bipolar disorder is a chronic or episodic, which usually means occurring occasionally and at irregular intervals, mental disorder. It can cause unusual, often extreme and fluctuating changes in mood, energy, activity, and concentration or focus. Bipolar disorder sometimes is called manic depressive disorder or manic depression, which are older terms. Everyone goes through normal ups and downs, but bipolar disorder is different. The range of mood changes can be extreme. In manic episodes, someone might feel very happy, irritable, or up. And there's a marked increase in activity in the activity level. In depressive episodes, someone might feel sad, indifferent, or hopeless, in combination with a very low activity level. Some people have what we call hypomanic episodes, which are like manic episodes but less severe and troublesome. Most of the time, bipolar disorder develops or starts during late adolescent or during the teen years through early adulthood. Occasionally, bipolar symptoms can appear in children. Although the symptoms come and go, bipolar disorder usually requires lifetime treatment and does not go away on its own. Bipolar disorder can be an important factor in suicide, job loss, and family discord, but proper treatment leads to better outcomes. So let's talk about the symptoms of bipolar disorder. The symptoms of bipolar disorder can vary. An individual with bipolar disorder may have manic episodes, depressive episodes, or mixed episodes. A mixed episode has both manic and depressive symptoms. These mood episodes cause symptoms that can last a week or two, or sometimes longer. During an episode, the symptoms last every day for most of the day. Mood episodes are intense. The feelings are intense and happen along with changes in behavior, energy levels, or activity levels that are noticeable to others. So as LCSWs, when we diagnose bipolar disorder, again, it's very important that we work with a psychiatrist that can properly treat bipolar disorder with the right medications. It's very important. And it's also, if we are providing psychotherapy to clients with bipolar disorder, it's important that we do the proper, that we do a really comprehensive assessment, which would include a suicide risk assessment. And that's usually true when we're working with all of our clients. You know, regardless of diagnosis, we want to do a comprehensive assessment, which does include a suicide risk assessment. And that's going to be actually a topic of another video. So let us talk about the seventh mental health or mental illness that we want to bring awareness to during Mental Illness Awareness Week. And that would be substance use disorder or addictions. Okay. So did you know that addiction to drugs or alcohol is a mental illness? Substance use disorder changes normal desires and priorities. It changes normal behaviors and interferes with the ability to work, to go to school, and to have good relationships with friends and family. In 2014, 20.2 million adults in the US had a substance use disorder, and 7.9 million had both a substance use disorder and another mental illness. More than half of the people with both a substance use disorder and another mental illness were men, or 4.1 million people in the United States. Having two illnesses at the same time is known as comorbidity, and it can make treating each disorder more difficult. Let's look at another substance use disorder, namely tobacco use disorder. Tobacco is another substance associated with addiction and health risk. It can be smoked, chewed, or sniffed, and now it can also be vaped. However, the most common way people consume tobacco is by smoking cigarettes. Research has shown that adults with a mental illness are more likely to smoke cigarettes than other adults. This is particularly true among people with major depression and those diagnosed with schizophrenia. So again, when we are doing our assessments, it's important that we assess for whether the person has a tobacco use disorder or not. And if they do, we're going to let them know that treatment options are available for them as well to go from addiction to recovery from the tobacco use disorder. Okay. So it is estimated that people with psychiatric disorders purchase approximately 44% of all cigarettes sold in the United States. Wow, that's incredible. Smoking is believed to be one reason that individuals with mental illnesses have more physical health problems and die younger than people without a mental illness. So again, there are treatment options if you're working with clients that are addicted to cigarettes, tobacco, vaping. We do have medications on the market, so as LCSWs, what we're going to do is we will refer our client to a medical doctor, whether it's a psychiatrist, whether it's a primary care doctor, and those doctors can talk to the patient about the different medication options that are available to them. Okay, so before you leave, if you can smash that like button, share this video with your friends. If you haven't yet subscribed to this channel, please subscribe. Again, the vision of this channel is to create a community of hope for LCSWs where we can come together, where we can share information, where we can talk about topics like Mental Illness Awareness Week, where we can talk about topics like World Mental Health Day, and that's going to be the subject of the next video. So thank you for sticking, thank you for watching this video to the end, and I look forward to seeing you on the next episode. Last word is take care of others, and most importantly, take care of yourselves. Bye for now.